Good morning. I am Chandrasekharan, founder and chairman, Kidney Foundation. Awareness and emotional effects of kidney transplantation. Dialysis and kidney transplantation are the two basic treatments for chronic kidney disease or chronic renal failure. The patient is placed in a situation where he is totally dependent on a machine and medical personnel 2 or 3 times a week. He needs a strict diet and multiple daily medications. Water intake is reduced to sucking a piece of ice. The cost of the treatment is prohibitive, and the loss of working days due to treatment adds to the financial stress. Depressed mood and depressive syndromes are common occurrences in these patients. This is understandable since depression commonly follows loss, and these patients lost their independence, strength, job, and energy. The evaluation of depression is complicated by the fact that the symptoms of end-stage renal disease, such as diminished appetite, loss of energy, constipation, and diminished sexual ability, resemble the somatic symptoms of depression. Presence of poor self-esteem, crying spells, helplessness, and suicidal ideation are better indicators of the disease. Organic brain syndromes such as delirium and dementia are also common in these patients. Patients involved in intellectual work notice progressive impairment in their intellectual abilities as the day of dialysis approaches. Renal transplant is usually considered the treatment of choice. A successful transplant dramatically improves the quality of life of the patient. The patient is free from dependence on a machine, dietary restrictions, and loss of work days due to dialysis. Cognitive function is set to improve, and the children growth and development returns to normal levels. Transplantation has its own problems. The patients are on lifelong immunosuppressants such as steroid, which have their own side effect. The fear of rejection looms large, and the patient still has to be under regular medical supervision. Some workers have not found any difference between transplanted patients and those on dialysis on a measure of psychological adjustment and vocational rehabilitation. In view of the contradictory findings and Indian studies in this field, the present study are undertaken to find out the prevalence of depressive symptoms, cognitive function, and life satisfaction. Hemodialysis patient, and to assess the changes in these parameters following a successful renal transplant. Thank you.